So a score update while we're transitioning, still 1-0, I believe. Second period, rather. We're going to move now to the non-governmental organizations, and Jennifer McPartland will be the moderator.
Good afternoon, everyone. My name is Jennifer McPartland. I'm a senior scientist in the health program at Environmental Defense Fund, and I had the pleasure of moderating the NGO session. Like my colleagues here on the panel, in the health program at EDF, our mission is to improve human health by reducing exposures to harmful substances. Our panelists are Nsedu Witherspoon, who is the Executive Director of the Children's Environmental Health Network, and also Kristi Pullen Fedinick, who is the Director of Science and Data at the Natural Resources Defense Council. We also had just a wonderful group of participants that were very engaged and I think shared a lot of creative, interesting ideas, and we did a pretty good job of actually walking through all of the questions that we were charged with. So I'm actually going to let our panelists give you an overview of our conversation, and then I will sort of chime in where I feel it's appropriate, fill in gaps, and then of course allow for an opportunity for questions and comments. So I think, Kristi, you're going to start us off?
Yeah, great. Thank you, Jennifer. So I only had 3 hours of sleep last night. I have a 15-month-old, so I'm going to just have the high-level brief comments, and then Nsedu will give you the details. We spent a lot of time focused on the plan itself, right? So we had some thoughts that came out. We talked a lot about partnerships and different things that our sector could offer. We talked a little bit at the end about the contribution that we'd like to see from the other groups that are having their panels today, and I'll give you a sneak preview. You can figure out which ones we think these apply to. So we want one of them to give us funding. We want one of them to have better education. We want one of them to survive and be protective, and the other we want just to be transparent, accountable social actors. And so we'll figure out which ones those apply to. It's multiple choice, and it could be, you could have it applied across multiple sectors. So if anyone has funding, feel free to send that along. So the initial discussion really did focus on the plan itself. And so I think that there was enthusiasm, and I would say tempered enthusiasm about the plan, where there was a desire to, at least initially, really think heavily about process. And so what is it that the plan is trying to achieve? What is the initiative trying to achieve? What would be the ways in which you would like to achieve that, and what does success look like? So there was some disappointment that was discussed a little bit about the fact that it didn't focus enough on local government, right? So the role of local government at the state level, at the city level, at the tribal level, to really influence health of people and constituents that exist in that space. And I don't know, are you going to talk a bit more about? Okay, so Nsedu will talk a bit more about that. We again then also focused a bit on how the NGO community could be a good partner in trying to facilitate some of those dialogues that would need to happen, and really ensuring that this initiative can be both embraced by communities, but at the same time productive in achieving its environmental health goals. And so I'll turn it over to Nsedu.
Thank you. I'm with the Children's Environmental Health Network. We're right here in DC, but national in focus. I've always had the same mission for 26 years now, to ensure that all children have the safest and healthiest environments possible. I'm also wearing the hat of the Cancer-Free Economy Network as well. And my background's public health and child health. So yeah, it was really a robust, I feel, discussion out here with some light coming in. It was good for all of us, a really good group. We appreciate everyone's engagement. In the beginning, we did have a nice report back on just reactions and how people were feeling to date. And then there was a suggestion of defining an engagement model. So that would be quite critical towards the very beginning stages. And we talked a lot about the benefit of having the 3 presidents of the academies here, and what a huge leverage that is to have that engagement right away, and that we understand that how very meaningful that is. Communications came up, effective communications. This is coming up a lot among NGOs, public health, and many others. There are some great resources and tools out there, great leaders, great folks really making some and efforts happening. But at the end of the day, when we look at the health outcomes, the actions that we're all encouraging and helping to move forward with these communications are not as effective as they can be, and we all recognize that. So again, if this can be yet another effort to help leverage effective communication models, strategies, that would be phenomenal. Case stories with community voices would also be very effective. We see this working a lot to really have the community speaking for themselves, but also the engagement, all the partnerships and collaborations involved. And we understand there's never a just perfect road. There's always bumps in the road. But what are those case examples out there where communities are rising above, meeting the challenges head on, and also finding success at whatever metrics they've determined? And then there was the challenge of what is the role of the academies, as you've talked about, and just the role of actually empowering the varied groups that are suggested to pull together. We highly support this, of course, but we also recognize the challenges with that and encourage that those challenges be thought of, considered well early in this process. And then we did talk about collective criteria. So what collective criteria can we do and suggest as far as maybe identifying and fine-tuning and prioritizing the topics of interest, and then overlapping those criteria with the identified needs and requirements, such as health protections, health equity needs, engineering components, health economic cases, effective communications, and other key stakeholder needs, of course. And then those results, as one approach, could potentially be compiled into a high-level blueprint, maybe a course of action that the academies adopts or is very much part of, that helps to identify the criteria selected, the partners, the process needed for effective engagement, the leverage points there for actually pulling together successes, that this could be a platform that could be offered high level for others. But again, to have the academy's leadership in that would be tremendous. And then topics could be determined as identified. Do you want to get into some of the portfolio ideas?
Yeah, so we had a discussion to take a portfolio approach. And so before talking about some of the ideas, so a portfolio approach would have the grand idea of what it is that you'd like to accomplish, and then have specific projects or project areas that would then allow you to demonstrate how that grand vision would be implemented on the ground. And so there are a number of different tactics or topics that you would want to think about. So, potentially figuring out or identifying a topic that the science is well known. There are just political barriers or other barriers, something like that the academy could then assess and try to determine what would be the thing that would need to happen in order to advance that particular, let's say, policy or, that health outcome across the table. Another approach would be to select something and so something like that might be lead, for example. Another approach would be to look at something where the science is still evolving, and so that might be the EMF topics that we've discussed a bit today. And so something that we would need to have scientific leadership from the agency to really, or not the agency, the academies to really be able to push that forward. We also talked a bit about how we could, think about projects that, again, weren't necessarily centered on what we consider to be prototypical environmental factors. And so maybe you'd have a project that looked at, say, birth outcomes for Black women and how the environment impacts that or affects that. And so using that as your, starting point rather than thinking about air pollution, you think about the outcome and particular, say, health disparity that may exist and focus on that specific disparity. And then work on trying to figure out the environmental components and what you might be able to ameliorate based upon understanding that process even more. One of the things that we also discussed was that, and this kind of gets into the buy-in ultimately, is one of the cautions you'd have to have with a portfolio approach would be if you have something that's very specific that certain groups are interested in. So if you're studying, and I kind of gave the example of the microbiome of the refrigerator, and you have very specific people that are interested in refrigerator microbiomes, you're not going to have a diverse audience that's coming to that specific talk. And so how do you think about ways to engage folks, either have a commitment or engage them across multiple topics to ensure ensure you have buy-in from people that aren't just specialists or consider themselves natural specialists in those areas. And so to take that portfolio approach, again, really trying to ensure that you're looking at topics that help you illustrate how you could influence specific outcomes, but then also ensuring that you're communicating those problems and getting buy-in from the different sectors that you would want to ensure that multi-sectoral and multidisciplinary approach to those problems.
Mm-hmm. Thank you. And a few other topics, water quality overall, so of course drinking water, but beyond for sure, and biomonitoring, so who's exposed to what and when, for example, looking at the technology implications, so understanding exposures of our technology of various forms, and a huge component there, an opportunity among biomonitoring needs for sure. And then we had a discussion about what NGOs can offer in this process, and I'm sure it can go well beyond this, but in the time we had, these were some of the topics brought up. First, that there is a vast diversity among NGOs, so there's really not one that's alike, and some are associations, some are member-based driven, and just how we're even created and set up can be very different, and of course that diversity then lends itself to the networks that we then serve and are a part of, so we just wanted to offer that. We see that as a benefit, but it's a reality that has to be acknowledged. And then the vast relationships, the long-standing rapport, respect, the science base by which all of our work then happens and stands on, the collaborations, trusted messengers, connections and partnerships with community leaders, community organizations, and all through the gamut, regional, state level, certainly is offered here, and a whole bunch of lessons learned. So again, effective communication and how we're all, trying to trudge through that and become better messengers ourselves. Actually having some messengers that are effective in some ways that could be offered to this process. And of course, all kinds of advisors on our own right. I have a science committee, an education committee, and a policy committee, as well as a board of directors, for example. And these are outside groups that help advise us, and they come with us to the table as many other groups would have that extension as well. And some existing examples, there are many, but these are some existing examples of partnerships. So many NGOs are part of larger collaborations and partnerships with this whole spirit of breaking down silos, understanding we're much stronger together, and we can each bring unique perspectives to then lend ourselves to a common goal. So there is the National Environmental Health Partnership Council that the American Public Health Association helps to convene. It's community, state, tribal, national, federal partners, NGOs that come together, and we give some feedback back to the CDC, ATSDR, but obviously have implications broader. We've dealt with messaging. We've dealt with how to define environmental health, because this is still a problem out in the general public. What does environmental health mean? You first got to get over that challenge before you can then get to whatever said topic may be, before you lose people, as far as making it meaningful and personal to them. And that's, 30 plus groups engaged there. There's Clean Water for All that's working on all kinds of drinking water issues. It's a hodgepodge of all kinds of different kinds of groups and expanding. The Cancer Free Economy Network is 70 some groups and growing, and we're trying to change the paradigm of how we look at cancer, not just at treatment, but when there's existing science that lends us to preventive strategies, to actually be working on those and letting the public know about those steps that they can be taking to reduce exposure. There's the Lead Service Line Collaborative that's working on lead service line expediting lead service line replacements in the country. And there are some states that are totally taking lead. It's not easy. It has to be funded, but it's being done. There are the pediatric environmental health specialty units. There's one in every region of the country. They're vastly underutilized, I would say, because they don't have huge marketing dollars and communication dollars, but they're phenomenal. They have a public health case manager. They're always affiliated with pediatricians and pediatric nurse specialists and practitioners, and they can lead all the way through inquiry to anyone that calls a toll-free number in their region or goes to their website or comes to visit them, all the way to clinical care referral if needed. So they're a huge asset. And then I learned today about the Thriving Earth Exchange that's looking at how to use community science leaders and to harness the science in the most useful way available. So we could go on, but we just want to give examples. These are hundreds of groups combined, if not thousands, that come together, are trying to work together, that are bringing our voices to that could also be part of some of this work moving forward.
Yeah, and then really quickly, just to follow up on that, one of the other big areas that we talked about was engagement, and we already learned about this in the foundations discussion, but really thinking about DE&I and making that explicit in the setup of what this initiative is going to be. And diversity could be, looking at, say, racial and ethnic inclusion, but also youth engagement is really big. It came up as something that was really important for our group. And so ensuring that you have multi-generational voices that are occurring in these discussions. For equity, really explicitly also thinking about the power dynamic that exists between the different groups that are represented on these panels and the power to affect change. So I think that, kind of gets at equity. Inclusion, developing toolkits. So if you develop a 300-page report, that's beautiful if you have 600 staff and you can sit back and read it leisurely, when you're on vacation on the beach. But if you only have 2 staff members and you have very limited resources and time, are there ways to develop very succinct, very easily digestible ways for smaller NGOs to be able to digest and use that information in a way that would be helpful and beneficial to being able to push those findings forward as well. So really thinking about in the problem formulation step, that inclusion of, again, this non-monolithic, non-NGO space and how you can engage different types of groups in different ways.
Well, there's one other thing about what we want from other sectors. Do you want us to get in? That was the last piece. So the multi-question answer.
One of the benefits of having extremely competent panelists is it makes my job as a moderator very simple. I just sit back and enjoy the show. So let's go.
Some moms here. We have to divide and conquer. I'm the mom of 4. Anyway, that's a whole nother story. Okay. So some of the needs that we identified briefly towards the end of our conversation from some of the other sectors. So academia, maybe some of you have experienced some wonderful academics out there who've just told you flat out, look, I went into research or, in academia, but I don't necessarily feel comfortable, speaking before the media. So what we've seen and what we, would really like to encourage is at least kind of coming out of your comfort zone, if that is the case or a challenge, and considering communication training, because you would be some of your best messengers if, to talk about some of your own research or experiences at your university and in your training research portfolios. And that is something that would be hugely beneficial for the communities that are then receiving the information about translation of your science or opportunities in the public health space. And then also the understanding that there is a huge lack of environmental health content understanding at a lot of various, schools and curriculums, and then there's actually a backtrack happening as far as mandating environmental health curriculum and courses, which is extremely alarming for us in public health. So that is not the direction we want to be going. In fact, we're finding even younger students are now learning about environmental health protections and stewardship and all of that. So we should be taking that lead and expanding our portfolio. And that even goes to our health professionals. To this day, we, every nurse and doctor, physician in this country do not get in environmental health 101. If you will. So that is something that's still a challenge and could be truly beneficial to any initiative here at the academies. On the industry side, we talked about, and this came up in the last panel a lot, proactively being a part of driving the solutions, and we would obviously endorse that 100%, and being very specific as much as possible about commitments would be extremely helpful for accountability, but also for the rest of us out in the communities to be able to track and to be able to support and acknowledge, the progress forward. And also for us to understand better for you, what are the barriers for your participation, if that ever becomes the case, or any additional obligations to you that are becoming major road barriers. That would, to the extent that you could be transparent about that, whether it's shareholder obligations or what have you, that was just a request that came up in the NGO discussion. And then in foundations, of course, support of many levels. Capacity is defined in many ways beyond hard dollars. That's always appreciated. But capacity in NGOs to be a part of efforts like this, to extend our staff, our expertise, to be a part of the advisory technical assistance, and any other role identified is extremely helpful, and the work that then pursues. And then also helping to talk among your colleagues as far as diversifying the pool of funders. We all know that there's a small, dwindling number of environmental health focused funders out there, or those that have an environmental health portfolio. And there are a lot of other funders, possibilities, and it would be extremely helpful if you can help. Many of these conversations are happening, but we really need to broaden that net severely. And then government, we just want you to survive and thrive. That was the core end of the story on that.
Great, thank you both. One thing that I think would be helpful to hear a bit more from the both of you is we did discuss this portfolio approach to selecting topics. I think something else that came up in our discussion was thinking about selecting topics, and I think this goes back to a thought that was shared by Jason Reynolds on the previous panel, which is also thinking of a topic that could demonstrate early success, be something that has potentially buy-in across the political spectrum, buy-in and interest from multiple sectors, and where there may be also an immediate need. So I don't know if you guys want to talk a little bit more about that aspect of thinking about topic selection.
Yeah, something else that came out was making sure that it's across all of the different academies. So making sure that you have something that's science-based, something that's medicine-based, something that has an engineering component. And so really trying to identify where those intersections occur and where you can have both short-term gains, right, so that you can demonstrate that this is something new, right? And so I think that in some ways, and maybe I was just kind of reading the subtext, everyone is really hungry for that newness, but a little cautious that it's actually going to happen, right? So we've been to meetings for the last 20 years and everything's going to be new. Everything's a paradigm shift. So making sure that you find those places that have that poetic intersection, right? But at the same time, allow you to have both short, medium, and long-term gains and identifying those opportunities. And so I think that multidisciplinary approach with, again, immediate rewards or immediate demonstrations of the newness and novelty, I think would be beneficial.
Yeah, and we actually tried even taking an example of just walking through what some of those topics may be, like lead was offered as, really no new science needs to come out. It only helps to, add to what's already out there. We need to be acting on the science and the public health measures ahead. And then even talking about things like targeted cancer prevention, where would that find itself and how it definitely overlaps with some of the other topics that were put up earlier by Dr. Burke, and acknowledging that there are many different ways for us to take this approach, whether it's the health outcome approach or whether it's what is the end game we're trying to achieve and backtracking it, or many other ways to do this, but that this that there will have to be a way to prioritize, of course, and that this could be one model of doing so.
Okay, great. So at this point, if there are questions or comments from the audience, they would be more than welcome.
Hi, Megan Latshaw with Johns Hopkins. And so I was delighted to hear you use the word biomonitoring. And I think I think there is a report on biomonitoring already out there, and I think that's one of the big concerns that Dr. Samet mentioned is, are we going to just generate a report that's not actually going to be implemented? But I would challenge the committee to think not just about biomonitoring, but about environmental health surveillance writ large, or the lack thereof in this country. I teach a MOOC, a massive open online course on chemicals and health, and over 40,000 people have enrolled in it. And they're consistently outraged and shocked when they find out that we really don't have a state-based environmental health surveillance system in the U.S. And it's a very nonpartisan reaction. I've also seen the same reaction in my undergraduates that I teach. That, why aren't we measuring this? Why can't we answer this community's question about what background levels there are to this chemical that just spilled in their neighborhood? And we see it in all the emergency responses to chemicals, too. So I love biomonitoring as a topic, but I also think it's environmental health surveillance writ large.
Thank you.
I thought you were about to stand up. No, you're just repositioning. Okay, well, since I have some more time, one other thing that sort of came up, I think, during our conversation is the opportunity. So this initiative aspires to be differentiating, to be something new and a sort of a different face and activity of the national academies. And we talked a bit about how what that means for branding right out the gate. And so any thoughts you two could share about how important that is or what that might look like, I think would be helpful.
I think there were some traditional and then more emerging opportunities presented on one of the last slides before we went to lunch as far as what could be offered here and what some of this could start looking like. But there is a lot of leverage for sure within and certainly outside, and I would say even in the international community when reports and certain positions are, come out of the national academies. But I think what we also talked about was the importance of, as the funder panel also discussed, the last thing I think any of us want is another wonderful, important report, even if it's a newer aspect that then is then so then what? So I think being very thoughtful as soon as possible, early in this process, as far as what we are trying to gain by whatever set activities would be just as important as the activities themselves. And I think that also helps to lend to the seriousness of the branding. But I think already having something, initiatives, leveraging comments, high-level distinctions of this is so important that, all of our presidents are, behind this type of thing already starts us in a great position. And now it's a matter of how do we then take advantage and if you will, capitalize on, that momentum.
Yeah, and just to add to that very quickly, I think one of the things also to think about is rather than thinking about a trickle down and, pouring down of information from on high, really thinking about an evaporative type of process where you do really have community-led and community-directed topics that you're talking about. Because I think that the Academies has a really beautiful opportunity at this particular moment in time to provide support, authoritative support for lived experiences. And so there are people that are experiencing pain and suffering every day. And I think that to be able to provide that scientific support to support that community-led and those community-directed projects, I think would be a really beneficial way to think about this as well and branding it in that way.
Please.
And so you brought up some really good points about the ways in which a lot of NGOs often collaborate in hubs. And I wondered if you all talked a little bit in your group or have thoughts about ways that this initiative could make use of those hubs so that they're not getting one or two sample and individual NGOs to participate in initiatives, but rather making use of that ecosystem landscape to maybe have a little bit more of a kind of a representation of an array of groups that might be partnering together.
Sure. Thank you, Kathy. Did you introduce yourself? Kathy Sessions with Health Environmental Founders Network. So, for example, I'm here wearing the Children's Environmental Health Network hat, but also the National Collaborative for a Cancer-Free Economy. So I was given the blessing, if you will, and there are some other of our colleagues in the audience for sure, to be here and to provide those positions. My hope would be that we could encourage, because obviously you can't have hundreds of people in an effective committee or advisory group, but that we could be strategically thinking about, hey, how do we get, even more opportunity by one or two individuals that have their places or their feet in some of these other collaboratives. I mean, that could be one way to do it, not the only way, but it does offer two for one, if you will, type of experience. So that's one way to do it. But we didn't really have those discussions, Kathy, but that's just been my experience so far, that it would be very willing. Now, we did have discussions about capacity, to be totally open and honest, and I think there was a good discussion about, what could the NGOs offer, and it really depends on a tier of what's being asked, right? So sharing information and reports and things like that, that's fairly easy. I don't want to speak for every NGO for us to do. It doesn't take too much time, but engaging in an effective way, a formal way, serving on committees, that's another level. And then there's other tiers of technical assistance and, connecting with partners and bringing along our relationships and, doing that hand-holding, that type of thing. These are all different levels of time and engagement. And the reality is those come with capacity needs.
Thank you both.